We're going to talk about chlamydia infection today. Chlamydia. The reason why many young men think they just have a simple urinary tract infection, when it is more than that. Chlamydia is the most common sexually transmitted infection in the United States. There are about 4 million cases of chlamydia in this country every year. Chlamydia and gonorrhea, another sexually transmitted infection, can cause similar signs and symptoms. You can distinguish them by those. These symptoms include discharge from the penis or the vagina and pain with urination. However, chlamydia usually causes no symptoms. In addition, chlamydia can cause serious long-term complications when untreated. Fortunately, this can be treated with antibiotic treatment. Chlamydia infections are caused by a bacterium called Chlamydia trachomatis, which is just a fancy expression. It's just a bacteria called chlamydia. The infection is spread during sexual contact. A man does not have to ejaculate to spread the infection, and it is not possible to become infected with chlamydia by touching an object like a toilet seat. So don't fall for that. Your risk of getting chlamydia is greater if you have a new sexual partner, more than one sexual partner, or if you have had chlamydia before and have sex with a partner who wasn't treated for this infection. That's called reinfection. Chlamydia infections can cause mild to severe symptoms. However, most people have no symptoms at all. This is problematic because this means that it is easy to spread the infection without ever knowing you are infected. Up to 90% of women with chlamydia have no symptoms at all. And of those who do, the most common symptoms might include things that are not necessarily specific, like vaginal discharge, abnormal vaginal bleeding, abdominal pain, pain during intercourse, burning, or pain with urination. In men, up to 70% of the cases with chlamydia show no symptoms at all. But again, the most common symptoms of chlamydia in men include burning with urination, or pain with it, discharge from the penis, pain or tenderness of the testicles, or swelling of the scrotum. In men, different to women, it is very, very uncommon to have these symptoms. Chlamydia can cause also an inflammation of the lining of the eye called conjunctivitis. This can be caused by exposure to genital fluids such as semen or vaginal discharge from a person infected with the bacteria. How do we test for chlamydia? Well, testing for this is done with a sample of urine or with a swab of fluid from the vagina, or from the cervix, which is the lower portion of the uterus in women, from the urethra in men, which is the pipe that brings the urine out of the bladder, or from the rectum in women and men. The results for this are usually available within 24 to 48 hours. Once a year, testing for chlamydia is recommended for all sexually active women who are younger than 25 years old, even in the absence of symptoms. At least once a year, testing for chlamydia is recommended for men who have sex with men. Otherwise, testing of young sexually active men should be considered in areas of high prevalence, in places like adolescent clinics, correctional facilities, and sexually transmitted infection clinics. This is because chlamydia is common in these kind of populations, and infection usually does not cause symptoms. Chlamydia in women can lead to a serious infection called pelvic inflammatory disease, or PID. If chlamydia is not treated, up to 30% of women may develop this type of infection, which can cause scarring of the fallopian tubes, the tubes that bring the eggs into the uterus for reproduction, which obviously can lead to infertility and the risk, an increased risk, of something called ectopic pregnancy, which is the formation of a pregnancy outside of the uterus, which could be life-threatening. How do we treat chlamydia? Well, for most infections, the recommendation is to take an antibiotic called doxycycline twice a day for 7 days by mouth. Doxycycline is not used in pregnant women because of the risk of harm to the developing teeth and bones of the child, of the fetus. For people who are not able to take doxycycline, a one-time antibiotic treatment can be taken by mouth called azithromycin or Zithromax. Azithromycin is also safe to take during pregnancy. It is important to not have sex for 7 days after this one-time antibiotic. It is important to remember that some people who are infected with chlamydia may also be infected with gonorrhea. So testing for this infection is usually done also at the same time as chlamydia testing. It is important also for you to remember that you should not have sex until 1 week has gone by after you and your partner have completed treatment. It is possible to be infected with chlamydia more than once, and the most common reason for this is failure to treat your sexual partner. Remember that anyone with chlamydia should have another test for chlamydia about 3 months after you've been diagnosed, because many people, as many as 25% in some cases, are reinfected from untreated sexual partners. But how can we prevent this? Well, the most effective way to prevent chlamydia is to avoid sexual intercourse, but this is not practical for most people. Therefore, the following tips will be very helpful. Use condoms every time you have sex. Discuss testing for sexually transmitted infections with your medical professional. Ask them if you are due for a chlamydia screening. See a medical professional if you have any symptoms of chlamydia or another infection. If you presume that, just ask. Do not have sex if you or your sexual partner has had an abnormal discharge, burning with urination, or a genital rash or sore. These are my 5 things to remember regarding chlamydia infection. First, chlamydia is a common sexually transmitted disease. Second, you can get infected even if your partner does not have obvious symptoms. Third, not treating chlamydia can lead to serious consequences. Fourth, treatment is simple and effective. And finally, the use of condoms is one of the most effective ways to prevent chlamydia.